I've got my eyes on you, and I'm here to remind you to make sure you get your eyes looked at. Your annual eye exam. It's critical you have that routine checkup. And today, let's learn all about the structures of our eyes. Great to be joined by Dr. Elizabeth George, who is an optometrist, and you're at Watson Clinic. Thanks for being here.
Yes, happy to be here.
So we're going to get into this cool visual aid that you brought with us. I love to look at this kind of stuff. I'm very into like anatomy, and it'll be fun. But I do want to start with the importance of an eye exam. A lot of times people put it off, but it's something you have to stay on top of. You have to do it once a year.
Yes, yep. It's one of those things people don't really think about until they have a problem, or if they're having problems with their vision. But just a routine exam, the same way you do an annual physical, make sure a lot of the eye conditions are preventable and treatable if we catch it early. So, and then just, routine stuff, glasses, contacts, stuff like that.
Yes, all of that. And I know you said you wear glasses and contacts, so you appreciate all of this stuff.
Definitely.
And even for those who don't, you still want to come in, get your eyes looked at. Let's talk about the structures of the eye, what we can learn from this today.
Yeah, so we've got our model eye here. There's a lot of structures of the eye. It's quite complex, and just this will be kind of a simplified explanation, but these are kind of things we're looking at when we do an eye exam. So front of the eye, it actually comes off here. It's called the cornea. It's a clear tissue, so looks just like this. Most people don't even realize they have it.
Sometimes, so if you get a scratch on your cornea, this is what we're talking about.
That's what we're talking about.
Part.
Yes, definitely. So that part is really important for it's got to be nice and clear and healthy for you to see clearly. So I kind of equate it to almost like a window. If the window has smudges or is thickened or blurry in any way, you will have blurry vision because of that. So
That's a great
we check the cornea.
Okay.
You can kind of see the colored part of the eye behind it. So this part right here, that's what gives you your eye color. It's called the iris. So it's actually a muscle. That muscle has the pupil in the center, and so the pupil is actually an opening. People think it's like a structure, but it's actually the opening inside the iris that allows us to see in the back of the eye. So
interesting.
Yeah.
Okay, so is that when you do, let's talk about those exams that you do when you go and get your annual checkup, because you're going to look at things like, you're going to do, what is it when you put the eye drops and you dilate?
Yeah.
That's what you're trying to look at, right?
Exactly. So the dilation drops kind of open up the pupil, and it helps us to see the back of the eye.
It's always fun to get that done and then go to the grocery store and people are looking at you like, what are you on with your eyes all big like that? You don't do the puff test anymore, though.
Not at our clinic, at least. We do some other things because nobody really likes the air puff very much.
Okay, okay. And what are the other things we need to be keyed in on, things to look for, those preventative diseases that you can screen for?
Right. So in the back of the eye, I'll actually mention it. There's the lens of the eye that kind of sits behind that colored part. There's a disease that can affect the lens, which is called cataracts, really common in people that are over age 45, around that time. So that's something we screen for, definitely check for. It can affect vision a lot. And then in this structure, you can see the back of the eye, which is called the retina. There's painted little blood vessels and things you can see, but there's a lot of important things in the back of the eye, so it can point us to the health of the body in general, and there's a lot of prevention we can do there. People don't really realize that, but and then the eyes are also connected to the brain, and so we can see a lot of brain things, neurological things.
That's what I was reading about, that there, I mean, it obviously is a window to, they say the eyes are a window to the soul, window to your brain too, to make sure things are healthy.
Definitely.
In that realm, yes. It's been so great talking with you. Thanks for the great information and the demo. I always love this kind of stuff. Like I said, watsonclinic.com, all the information for you there. Thanks so much.
Yeah, thanks.